Let's talk about carpal tunnel syndrome. I'm Katie, I'm a hand therapist in New Zealand and I'm building a database of hand therapy conditions that people can refer back to online. Your carpal tunnel is an anatomical area in your wrist, right here. And it's called your carpal tunnel because you have carpal bones, there's 8 of them in your wrist, and they make a semicircle, and you have your flexor retinaculum running across the top, and that makes a tunnel, hence your carpal tunnel. And through your carpal tunnel, you have 9 tendons and your median nerve running right on the top, directly under that flexor retinaculum. So carpal tunnel syndrome refers to median nerve aggravation through the carpal tunnel because that median nerve gets compressed. Your nerves branch out of your spine and they travel down towards your extremities. Your median nerve runs down through your forearm, in through the front of your wrist, and it supplies your thumb, index, middle finger, and ring finger sensation-wise. The motor supply can be a little bit different, but it does supply this big muscle bulk. Compression on the median nerve can happen in a number of ways. The tendons that run through the carpal tunnel are the tendons that control flexion of your fingers. And so repetitive flexion causes compression through that carpal tunnel as those tendons and muscles bulk up when you use them. This means that physical jobs where there's a lot of repetitive gripping, lifting, pushing, pulling involved can often cause aggravation of that median nerve at the carpal tunnel. In this day and age, office workers also frequently develop carpal tunnel because they spend a lot of time typing, and when you use your fingers, you're using these tendons which can apply pressure to that nerve. You can also aggravate that median nerve from repetitive weight bearing on your hands because you're applying pressure straight through that area, or simply spending too long in a flexed position at the wrist. Symptoms of median nerve aggravation are things like tingling, numbness, or any type of sensory change in the thumb, index, middle, or half of your ring finger, as well as weakness, dropping things, or decrease in this muscle bulk. These symptoms can often be worse in the morning because people like to sleep with a tucked up wrist like this and compress that median nerve for the whole night long. As well as compression, excessive tension can also aggravate that nerve because it affects the blood supply going to the nerve, so the best position to keep your wrist in is neutral. Other things that could aggravate carpal tunnel syndrome are things like diabetes, fractures in your hand or wrist, pregnancy, arthritis, obesity, or hypothyroidism. And most of the time, this is because these things add fluid to the area, which increases the pressure in the carpal tunnel. In hand therapy, we do specific tests to assess for carpal tunnel syndrome. As well as these carpal tunnel tests, I'd also do other tests to rule other things out, but we'll just focus on the carpal tunnel tests. So firstly, I'd observe your hands and look for any decrease in muscle bulk. I'd then touch your hands through your median nerve distribution and ask you if they feel the same on both sides. We sometimes use a special tool to do this with as well. I'd then do some special tests to assess the median nerve. Firstly, Tunnell's test. This is where we apply pressure to that median nerve through firm tapping to see if we can replicate any symptoms into your hand. Secondly, Phelan's test. This is when we do this to cause deliberate compression at your wrist to see if we can replicate any symptoms. And thirdly, the most specific test is Durkin's compression test, where we simply apply pressure to your median nerve and hold it and see if we can replicate any of those nerve type symptoms. I would also check your grip strength because often median nerve aggravation can cause weakening in the hand, and it's also a good parameter to have between sessions to review whether you're improving or not. So how do we treat the median nerve? The first and most important thing is some sort of brace, and that's to try and reduce compression on that nerve by lots of repetitive movement. We ask you to wear this definitely overnight and during the day if you're bad enough, or if you notice that activities that you're doing in daily life are adding compression to that nerve. A brace like this with a bar through here is best, but sometimes you need to straighten out that bar to stop it from poking you right in the palm here and adding compression through the night. The second most important thing is activity modification, which is recognizing what is causing your symptoms and doing what you can to avoid it. It might be that you're working on a computer all day. It could be that you're a baker and you're repetitively gripping and kneading. It could be that you're a builder and you're doing a lot of physical work on a daily basis. And these things can be really hard to avoid. Sometimes we need to take a bit of time off work to focus on true rest. Exercises that can be helpful for carpal tunnel are tendon and nerve gliding exercises. And this is because they help the tendons and the nerve at that wrist to move and free themselves from compression. Additionally, sometimes when you have an injury, scar tissue can form. And scar tissue is thick and sticky, and it can cause compression or adhesion in an area. Nerve or tendon gliding exercises can help free from scar tissue as well if anything's getting adhesed. The first thing that I would get you started on is a tendon glide for the flexor tendons in your hand. Hooking your fingers in, rolling them in, straightening them out, bringing them back up. Hooking, rolling, out, up. A couple of times a day, 10 times. That's a tendon gliding exercise. The nerve gliding exercise we don't want to overdo because technically we are applying a little bit of stretch to that nerve, which it doesn't like in excess. So we want to focus on nerve gliding 5 times a day max. These are a couple of nerve gliding exercises you could try. Hand out to your side like this, and moving from your neck as you move from your wrist. Because your nerves branch out of your neck, this is allowing the nerve to move back and forth as you move. Putting your two hands out in front of yourself, keeping your elbows straight and pushing forward from your shoulders. You should feel a gentle stretch in your hand. If any of these exercises cause worsening of symptoms, it's important that you stop or reduce the frequency at which you're doing them. Nerves can take time to heal. They're one of the longest things to heal in the body. So usually I tell my patients to expect at least 12 weeks until you're feeling good. If you're a patient of mine, I'd ask you to come in every 2 to 3 weeks to redo some of the tests, especially grip strength, and make sure that you're on an improving trend. If you're not improving after about 6 weeks, this is when I'd start to consider referring you for a cortisone injection. A cortisone is a high-dose anti-inflammatory done directly into the area to try and get rid of some of that swelling and aggravation. It's usually really effective for the median nerve because it reduces pressure so much in the carpal tunnel. Cortisone injection is obviously not going to be so helpful for someone who's pregnant because it won't reduce fluid in that area, but for someone who's caused aggravation and swelling over time, it can be really helpful. Cortisone injection usually wears off after about 6 months. You can have 2 cortisone injections in the same area, but after this, we would refer you to a surgeon to talk about a release surgery. I'm not a surgeon, so I won't talk about surgery in depth, but I have witnessed a few, and the most common practice is making a small incision here and going in with the aim to reduce compression in that area. After carpal tunnel surgery, you're usually in a bandage for the best part of 10 days until your stitches dissolve or until you need to get them taken out and while that wound heals. We often do hand therapy for 2 to 6 weeks, We often do hand therapy for 2 to 6 weeks after this, aiming to help you to care for your scar tissue, regain normal sensation in your fingers, and build up strength again through things like gripping, pinching, and rolling. Before I discharge you from hand therapy, I'd usually want to make sure that your hand is at least 80% of the grip strength of the other hand without pain. Carpal tunnel is really a spectrum. Some people come right with conservative management in a month, and some people have symptoms for years before they get it operated on. If you have carpal tunnel and your symptoms are bothering you, you could try with a splint from home or come in and see a hand therapist.